Good morning, everybody. I'm just going to get all my password-protected items opened. It's already been an interesting morning. I've learned I've never made a mistake, so that was exciting. I've also learned you guys ask really hard questions, so I may talk longer than I'd intended to fill the time. And it is true that I was inspired by Dr. Gigi Osler in terms of considering this role as CMA president. So those are what I can tell you so far. So I'm really excited to be with all of you this morning. Many of you are just Twitter people to me, so now I realize you actually exist in real life, so that's like quite exciting. I saw names on the program looking around the room. I'm like, oh, that's a real person. So yeah, it's quite nice, especially for someone who lives in a remote part of the country. I've spent most of this year in my basement doing this job, so it's quite exciting to be outside and seeing real people. Today I'm hoping to share a bit of my story with you, and also just some reflections on medicine, leadership, and advocacy, including how and why I got involved with the CMA. And I hope to touch a bit on what I see as the changing role of physician advocates and advocacy organizations like the CMA, and how together I hope we can build a movement towards a better health future for everyone. So I do have some conflicts of interest that I don't actually have. I have to tell you I don't have them. So I am the president of the CMA. You probably knew that already. Yeah, there you go. And what does that say? Yes, these have been mitigated, apparently. They do pay me to be the president, I'll admit that. Okay, so what are we going to be talking about today? So there's a few overarching objectives. I think that I'm hoping that together we can think about why this moment in time is so important for creating real and sustainable change. I want to share a bit with you about the CMA's vision for a better future of health, identify how the medical community informs the CMA's work, and that's something that we're hoping to improve on, and we're going to talk a bit about how we see that change and that future coming, and talk about what we can do to realize that change together. So I'm going to start a bit with a story. I was fortunate to be involved with advocacy early on as a medical student. I was always outspoken and opinionated, and I wasn't really satisfied just with the talking about marginalized communities that happened in my undergrad curriculum. I really felt like I wanted to do something. Together with my colleague, Steve Mathias, who's now a child and adolescent psychiatrist in Vancouver, we founded a program called the University Health Initiative by students. And this program leveraged existing infrastructure in the downtown east side of Vancouver that wasn't being used in nights and weekends. And we also leveraged the fact that the existing chief medical officer of health for Vancouver at that time was our instructor in our course called Doctor, Patient, and Society. With his support, we founded an interdisciplinary clinic that was student-led, and that was in 2003, and we really spent our time in the community learning from patients, as we heard from Dr. Philpott. And I think those were a lot of my early lessons on the importance of advocacy. That program is still ongoing, to my knowledge, and remains student-led. So for me, those early experiences, I think, really gave me a different perspective on how to serve patients and communities beyond what I was hearing in the lecture hall or finding in the textbook. And it really played a role for me in shaping my career and how I saw myself as a physician and what I hope to do. Right from the beginning, it was very clear to me that systems and structures impacted the people we were trying to serve much more than medications or technology. When I chose pediatrics, for me, it was really from a desire to work with what we often used to call underserviced children, but I've now been educated that the better term is marginalized, and I agree. We also often call people vulnerable when really they're marginalized by our system. So I think sometimes that language is really important in how we perceive what's happening to people. I did my training in pediatric emergency medicine at Alberta Children's Hospital. I had also spent time in South Africa as a medical student early in the HIV epidemic. I then did rotations in Nunavut and eventually locumed in northern Manitoba. And all through those experiences, I continued to see what the social determinants of health meant for my patients and how it impacted them in their lives. I was very fortunate to spend several years as a peds emerg physician at the Children's Hospital in Calgary. It was a fantastic place to work. One of my good friends is here today, Dr. Bukovic, who's a pediatrician in Thunder Bay. We met there. I met many incredible people. I was mentored by many exceptional clinicians, and it really gave me, I think, an amazing foundation in terms of my skill set as a pediatrician. And I loved that job. I really did, and I loved the people. And so much of what made that job enjoyable was the team that I got to work with there. But I always sort of had this sense that it maybe wasn't my final destination. And I also knew it was a highly desirable job. And I used to joke that if I dropped during a shift, they could just kick me under the gurney. There'd be a lineup of people that would be ready to take that job, and that probably could just keep the place running in my absence. So that sense of being unsettled for me really forced me, I think, to reflect on what drove me as a physician, where my passions really were, and what role leadership might have in that future. So I'm feeling really good about this quote after hearing Dr. Philpott's talk, because I feel her and I are on the same page about purpose. So I started to reflect a bit about what excited me, where I found meaning, and I settled on a few things that I think matter. One is building things. I really do like finding problems and trying to solve them. Advocacy. I noticed I was always happiest when I was trying to change things for the better and look at systems and where I thought I could maybe have an impact or make something different. I enjoyed leadership. I recognize that I'm inherently bossy and outspoken, so I do like to have a seat at the table and be involved in these conversations. Public speaking is something I've liked. I've always liked to talk. My children tell me I talk way too much. So that was something that I knew I enjoyed. And fundamentally for me, it was also, I think, like we heard from Dr. Philpott, about contribution and meaning. I knew I had a strong desire to do something that I felt mattered, and I often found my sense of happiness or personal happiness really came from feeling like I was useful and contributing in some way. As I was in the process of these reflections, as often, the world sort of throws things in your direction, I was asked to teach a course in the Yukon on neonatal stabilization. So I went up there for the week, working with the family doctors and the nurses at the hospital, and I heard a bit more about the Pediatrics Program that existed at the time, which I knew a bit about because some of the visiting pediatricians were colleagues of mine, and actually 2 of them I'd gone to medical school with. But what was pretty clear from that time is that the program they had right then, which was a visiting program where there was 4 days a month of pediatric consultative clinics, was really just touching the surface of the needs for children in the Yukon. And I had a chance to speak to the pediatricians that were providing that service at the time, and they agreed. They knew there was a lot of things they weren't able to get to just because of the way the program was set up, and the time was quite small. So I sort of felt that maybe that was what I was meant to do. I sort of reflected on the time I'd had in the north that I'd found meaningful, the fact that I'd always felt like I maybe wasn't able to do as much as I wanted to in those communities because I wasn't part of the community, and I felt like it was a chance to really maybe build a system that would be better. So I went back home, saw my husband, who's also a physician. He's an orthopedic surgeon, which was convenient because they also didn't have an orthopedic surgeon. And I told him, hey, I've had these 5 days in the Yukon, and I think we should sell everything and move there. And he said, what kind of drugs do they have in the Yukon? I'm like, I did nothing like that. It's not what happened. But anyway, I convinced him of that vision. He's a good guy. He does what I want sometimes. A few months later, we had sold our house, bought an RV, and drove to the Yukon with our 2 kids and a dog. So that was about 5 years ago, and I've spent that time building a social pediatrics program and a team that I'm very proud of. And we now have a full-service pediatric program in place with 4 pediatricians. We have 365 call coverage to the hospital. We do outreach to almost every rural community in the Yukon. We have a neonatal and pediatric Medivac team and extensive partnerships with government schools and mental health programs for kids and a child psychiatrist. So it's been very meaningful for me, and I feel very proud of the community connections we've made. During that time, because people very rapidly realized I was bossy and liked to talk, I was voluntold into being the president of the Yukon Medical Association. And through that, I gained my exposure to the CMA, which is where I met also Dr. Osler, and probably why I'm standing in front of you today. So shortly after my time in the Yukon, and while I was in that role as YMA president, it was the Yukon's turn to put forward a candidate for the CMA president, and several people there sort of suggested to me they thought I should think about doing that. At first, I wasn't really sure because I knew it would be a big commitment. It is a full-time job, for sure, and normally in pre-pandemic times involved a lot of travel. But I sort of had a feeling that, maybe this is something that I could do. And after talking to my husband and family, decided, yeah, I should at least go for it. I didn't want to have that regret that I at least hadn't tried. And for me, again, it kind of ticked those boxes. And what I really, I think, fundamentally reflected on is if I'm really passionate about advocacy, how could I give up the opportunity to perhaps do that on a broader stage? And that's what made me decide to put my name in the hat. So that brings me to sort of where are we right now at the CMA and what is the vision for health? When I found out I had won the election in February, right before the pandemic was declared in March. So obviously this, like many of you, I think that my time in this role and really the last 2 years of my life certainly wasn't what I was expecting at that time. But it has really also been an exceptional time in medicine. I think never has it been so clear that we need to do more to strengthen and stabilize our healthcare system, to rebuild capacity and invest in the country's health workforce and reimagine the way we deliver care, and even reimagine what health and healthcare is and should be. I think it's become also clear that we need to step back and take that systems level view of the problems we're facing and the potential solutions. And it's very clear to me that if we only continue to tinker around the edges without having a clear vision of what we want to achieve, we will never drive the transformational change that's needed in Canada's healthcare system. My concern is that I really believe we cannot let our sense of national pride about Canadian healthcare drive institutional inertia because we fear change. At the CMA, when we're thinking about driving this change, we're guided by these sort of 3 principles you see on the slide. We want a sustainable, accessible healthcare system where patients are partners in care. And the choice of the word partner is intentional because we recognize both physicians and patients have responsibilities within that system of care and to each other. And we also know we need to do a better job of co-creating solutions with our patients. We want communities where everyone has a chance to be healthy, and that really deeply matters to me as a pediatrician, and I'm sure to all of you as well. As the research on adverse childhood experiences from the late 90s is becoming more mainstream and we're better understanding the impacts of childhood trauma, or what I now call developmental trauma, has on health, both physical and mental health, we know we must solve for these challenges like the future of our country depends on it, because it does. We want a new culture of medicine that embraces equity and diversity and sustains physicians as people, not only as professionals. I think we are finally coming to terms with the limitations of designing a system based on altruism. The importance of healthy providers for healthy workplaces and the real and measurable impact on patient care and patient safety, I think, is undeniable. We can no longer tolerate a medical culture where harassment and psychological abuse are normalized. We must also, I believe, build a profession that reflects the diversity of Canada so all Canadians can see themselves reflected in our work. So how do we get there from where we are? And most importantly, how do we get there without losing hope along the way? Because it can all feel pretty overwhelming. Right now, we're into the Omicron wave, and we know this has dealt yet another blow to a very deeply troubled system that's also really struggling. And I'm sure many of you right now are faced with pressures amongst your colleagues and on your hospitals about how people are going to keep going. We've seen emergency departments, which are often the bellwether, I think, for the whole system, really, really being crushed over the last few weeks and months. There's been huge personnel shortages due to COVID infections as it rages across the country, and hospitals remain over capacity as many people are coming into the system whose care was perhaps neglected earlier on in the pandemic. And we've all heard about the surgical backlogs that are looming and growing and now numbering in the hundreds of thousands of people suffering while they wait for really essential medical care. So with the ongoing evolution of COVID and the Omicron variant and what we are now seeing with relaxation of public health protections, I think all of us in this room know it's not entirely clear what's next, and that's the uncertainty that we're hearing about from Dr. Philpott, and there is really no way to know for sure. But what we do know is the pandemic has had a profound impact on the health workforce. We're seeing record high rates of burnout amongst physicians, more than twice what we were seeing pre-pandemic. And we're also seeing physicians that are really considering stepping back from their work. Our recent survey at CMA showed that almost half of physicians are thinking about cutting back their clinical hours in the next 2 years. And I think really concerning is we're hearing more and more doctors who don't feel that they can keep going in primary care, which is, of course, the bedrock and foundation of our system. I'm really noticing in some of the private social media spaces I'm in, Facebook groups for physicians, women physicians, they're really filling up with people in serious distress, and they are uncertain if medicine is for them. They're struggling to find the joy and the meaning in their work, and that, I think, is deeply concerning. The gaps that we've seen in accessing care are growing wider. According to a report that we commissioned in the fall, Delayed or missed healthcare services contributed to 4,000 XX deaths, not from COVID, between August and December of 2020. So if we extrapolate that over the course of the pandemic, we're talking about over 20,000 Canadians having lost their lives, not due to COVID, but because they couldn't access care. Add that in the growing opioid crisis that we know has gotten much worse during the pandemic, and those numbers only get larger. And I think all of us know that each of these premature deaths is someone's loved one and a community member. As I mentioned earlier, I'm really fortunate to do outreach work into Yukon's rural communities. And in the last 2 weeks, I've been in 2 different communities. And in both communities, all the youth I saw at my appointments had lost multiple community members to opioids, in many cases their families, in the last weeks. The Yukon has the highest rate of opioid death in the country. Just 2 days ago, I was in a community where a 17-year-old First Nations youth told me that 4 of his brother's friends had died from overdose in the last month. And he lives in fear because both his brother and his mother are living with substance use problems, while his father is homeless in Alberta with the same challenges. He himself dropped out of high school to care for his mom. He's told me that he's the person that people come to for support because they feel shame, and he doesn't judge them. He also told me he wished he had better role models and people to connect him more to the land. Just last year, he had a job for a week in the summer where he was hired to clear trails, and he realized just how powerful that connection to the land felt for him, and he wished there was more opportunities to connect there. But he also told me he hasn't given up yet on his future. I wanted to share his story because, to me, too often children and youth are part of the opioid story that we don't think or hear enough about. They're largely unseen, and their stories are largely untold. The majority of children I see when in community have lost a parent to addiction, whether to the streets, to jail, to overdose. The impact of the drug crisis is truly a public health emergency, perpetuating intergenerational trauma and dramatically impacting the next generation of children and youth. And I desperately wish we saw the same outcry in public investments we've seen for COVID for these children and their families. So this brings me to this question. What is our role in driving change? We know many other threats are emerging, including what I see as the ineffectiveness of traditional communication tactics in a social media world, the rising threat of misinformation, a loss of trust in experts, and increasing polarization, even amongst experts themselves, which further confuse the picture. And I think these issues threaten not only health, but pose fundamental threats to our democracy and civil discourse. The gap between where we are and where we want to be can feel impossibly large. And that's why I'm so grateful to be here with all of you today, because I believe our collective vision and commitment to doing better can help us move the dial, and I think we need each other to fill our tanks and keep us going in this work. So in the midst of this health and healthcare crisis, I want to share a few thoughts on what I think our role as physician leaders can be in driving change. So I believe we need to maybe think a little bit about what new skill sets we might need to embrace as pandemic and post-pandemic physicians. So a few questions for me come to mind that we, I think, need to think about. How do we engage with patients, citizens, and communities beyond the individual doctor-patient relationship? How do we compete with the rise of celebrities and misinformation peddlers who are occupying the health space and potentially unwinding years of progress? Our traditional press conferences are really no match for a well-done TikTok video or Instagram story. Social media has become the source of information and truth for many people, youth and adults. How do we ensure the millions of Canadians without a trusted doctor have access to reliable information? How do we best leverage our expertise? How do we embrace some of these new models of communications that maybe some of us have avoided because they make us uncomfortable, can feel self-serving, or may fall out of our belief set about what's professional? And most importantly, how do we move from aspirational to action to actually create change? Health and healthcare continue to remain a political hot potato. I think we all know that, and it's one of the challenges of our government structures in this country. But I think that does put us at risk of continued inertia. We also are facing the challenge of strongly held beliefs about what our healthcare system is And fears of change often can prevent, I think, real dialogue about what could and should be. I think our proximity to the United States often drives these fears as a worst-case scenario of what change could bring. Will we end up with an American-style healthcare system? When really, I don't think that's what any of us would see as aspirational. I think it's extremely important we challenge these longstanding ideas, policies, and processes that can actually act as barriers to progress and transformation. One example is physician licensure. In many ways, the current model can really impede physicians from best serving Canadians. There's so many opportunities to be explored around how one license could be recognized in every jurisdiction, with the goal of supporting locums for people working in rural and remote areas, which is a huge barrier to retention, cross-border virtual care to leverage different specialists and availability of providers, and helping us reduce wait times as well as modernizing our regulatory structures. If we really want to make progress on prioritizing physician health and wellness, we need to be able to take a hard look at the structures that are holding us back. Things like how some provinces ask physicians to report on their license that they've had a mental health challenge. That's a barrier to getting care for them. We recently know in BC, physicians were asked to provide a plan for all of their patients in the event of their sudden death when reapplying for their license. We continue to download the responsibilities for a broken system onto individuals, and I believe this is driving some of the burnout that we're seeing. And in my view, this must stop, and we need to have conversations about why this is happening. So many aspects of how we do things need a rethink, and physicians cannot bear the challenges of our system on our backs as individuals, but we need to be at the table contributing to the solutions. I absolutely agree with what Dr. Philpott said. I think there's never been a bigger need for physician leadership at the tables with government than there has been now. Our voices have never been more important for sharing what we know, our skills, and our vision for what healthcare could be. I think one of the lessons we've learned through the pandemic has been around the critical role of health communication, how much we struggle to do it well, and how powerful the misinformation movement can be. A recent review article on the prevalence of health information on social media showed it's as high as 87%. So again, I think we need to be thinking about why should doctors be involved in social media? And I think instead of saying, I don't know, or I'm not that interested, I think we need to recognize that social media is where we've evolved in terms of our community gatherings, our town halls, and how we distribute information and communicate with each other. If we don't evolve and show a presence on social media to educate and impart our knowledge about health, medicine, science to the public, and even things about the health system itself, other less qualified non-medical individuals will. There is a rise of celebrity and wellness influencers who are co-opting and dominating the health space. One such person is Candace Olson, who's generously offering her take on childhood vaccines to her 3 million followers. My concern if that happens, the health of our society will be worse off for it. And in the end, I think doctors need to be part of the social media ecosystem, and we should consider it an obligation, not an option, this day and age. However, we also know, and we heard a bit about this in some of the questions folks asked earlier, is that being in the public eye and under scrutiny, and particularly in the social media age, is not always easy. With more attention onto the health system and more healthcare workers speaking out, we've also seen a huge rise in personal attacks, threats, and harassment directed towards healthcare workers. We felt that we had a big win in January when Bill C-3 came into effect, which made it a criminal offense to intimidate, harass, or threaten healthcare workers in person and online. I'm proud of the role the CMA played in helping to make that happen and how it has the potential to protect physicians and other healthcare workers. We continue to call on government to make sure that it is implemented to create safe spaces for care. We also continue to work with social media platforms around how to make those spaces safer for physicians and other healthcare workers, as well as the public, as we try to share good information. I thought that this slide was quite interesting. This is a word map of which tweets garnered the most attention during the pandemic. And I think what we can see is the more emotive the tweet and the language, the more engagement it had. And I believe that this is driving polarization and can negatively impact information sharing and discourse. It's the people that are yelling are often getting the most attention, and the people that actually have productive things to say or want to explore the nuance of the complexity and some of the decisions in front of us don't always stand out in these spaces. I think we need to continue to really understand these spaces and the evolution of the dialogue that we're seeing so that we're able to effectively combat the parallel infodemic that threatens to disrupt and undermine our work. We've also seen a lot more coverage in traditional media around health. We've seen them shining a light recently with some very good reporting, I think, that look at some of the painful truths about our system. And I've really been trying to encourage some deep and real engagement on healthcare reform. I would challenge us as physicians to feel comfortable and ready to have these hard conversations, even if they're not easy and even if it sometimes means going against popular opinion. I think the reality is we can always get into a bit of a rhythm of what we think and what's acceptable, and it can be hard to break out of that thinking. But what we often can see is that commitment to the status quo or self-congratulatory behavior tends to drive groupthink. Some degree of conflict or challenging one another will be needed. Otherwise, we're going to remain in our silos and our separate camps of thinking. That's not going to lead to the generation of the new ideas we need to really drive the change we need to see. Polarization and the loss of civil discourse is really threatening our ability to reimagine our systems. And the reality is that big changes aren't going to happen in that type of environment. And I think one of our biggest challenges around leadership is creating safe spaces where people can really be honest and have these tough conversations with each other. Throughout the pandemic, the face of the medical profession has changed in many ways. We're finding ourselves taking on new leadership roles within the profession and the public and coming up against new challenges. As I talked about the critical importance of the physician voice in public dialogue, I think it's important both in traditional media and social media. At the CMA, we've really been working hard to try to better leverage the space, both traditional and social media. And our media engagement is up over 400%, and we've had millions of engagements monthly across our social media platforms. And again, I think this is a critical part of modernizing the organization and making sure our thoughts, what we're working on, and our visions for the future are accessible to the public and to our colleagues. I think it's important that when we look at associations that represent physicians, like the CMA, we need to make sure that they're structured in a way that's also supporting physician leadership and helping us to drive transformation in health. As many of you, I'm sure, know, the CMA has represented the medical profession in Canada for over 150 years. Having this strong legacy, however, can be a bit of a double-edged sword, like so many things, I think, to do with our healthcare systems and our organizations. There are many traditions, long-standing beliefs, policies, and processes in place that can be hard to challenge or undo. Challenging the status quo, as all too many of you in this room, I'm sure, know, often means disrupting those who have traditionally held power, and that is rarely easy to do or without conflict. The CMA recognizes that to deliver on the change we want to see, we absolutely must change the scope of our advocacy and our work, and that includes our approach to engaging physicians and medical learners. And this is something that I think the organization recognizes it's not doing well enough, and it's something that's been prioritized and that we're actively working on. I think we also recognize that we don't have all the answers, and we certainly recognize that we cannot achieve the change that we're hoping to work on as an organization on our own. It's important that we build a collective movement of diverse supporters so that we can co-create and act on the solutions to these very complex problems that are in front of us. Beyond lack of time, we know that many physicians don't know how to get involved with the CMA. It's often not clear, and recently as the organization's been structurally changing, there hasn't necessarily been a lot of opportunities for on-the-ground docs to get involved. What we're currently seeing is that we're really only tapping into a very small group of leaders. Beyond traditional leadership opportunities, we aren't necessarily appealing to everyone, and it's not really clear to physicians how they can contribute. There's also a lot of confusion about what exactly the CMA does, which leads to diverse and sometimes inaccurate perceptions of our role and confusion about our work and the work of the provincial and territorial medical associations and how that's different. Others may feel hesitant to get involved because they may feel that they've not been adequately seen or heard by the CMA, whether that's misunderstanding or misalignment with the types of issues we're pursuing in our policy positions. are not seeing themselves reflected in CMA leadership. I think we recognize that it may not always be clear to physicians how their involvement with the CMA will have an impact. And I think physicians want to spend their time where it matters and where they feel that they will have an impact. Traditionally, opportunities to be involved have been more at the surface level, being informed about what's been going on or sometimes being consulted. There's traditionally been fewer opportunities to take a real deep dive into the issues that are in front of us and to feel like you're part of creating a substantive change. We know that we aren't always creating that emotional connection between the profession and our work, and that that's important to people. We recognize we need to improve how and when we engage with the profession to affect the transformational change that needs to happen, and I hope that that's something that we are going to be more successful with over the next few months and years. We're aiming to develop more opportunities for physicians to meaningfully collaborate and problem solve together on issues that they care about. And our other goal is really to foster a sense of belonging with others and to inspire action through common purpose. We're aiming to clarify the intended outcomes of getting involved in the work of the CMA so physicians can understand the value of their contribution and the impact it can have. We want all of you to feel like you're able to contribute to something bigger, and I think all of us in this room are interested in leadership because that matters to us. We're aiming to provide a greater range of intuitive, accessible, and equitable opportunities tailored to physicians' desired level of involvement and their goals. So that's going to include expanding the definition of leadership beyond traditional thinking, such as serving on the board of directors or on a committee. Really, what we're hoping to do is provide physicians with a wide range of opportunities to get involved in ways that are meaningful to them and to create safe and accessible spaces for their voices to be heard and foster a sense of agency for every physician who wants to be involved and be part of creating that change. So really what we're trying to do is become a stronger, more relevant, and more inclusive organization, one that fosters and embraces the goals of clarity, connection, community, customization, and co-creation with the profession. What I hope for is that the end result is an organization where physicians feel connected and proud to be part of it, and ultimately an organization that can achieve the goals of driving the systems transformation that's needed while allowing us to create healthier communities for our patients and better serve our patients while we ourselves can find the joy and the meaning in our work. So this work, of course, is ongoing and not easy. It's aspirational, but I think we're headed in the right direction. And I think it's going to be a top priority in terms of when we reflect on what we're doing, some of the values that need to be driving those decisions. But there are some opportunities coming up in the near future that I want to share with you, and I hope that you'll consider being involved, and I want to reassure you there's more coming. So this year we've done our Health Summit series a little bit differently. We recently had a live Twitter Spaces event. We have a session with the Globe and Mail coming up shortly. And we're trying to bring together physicians, patients, policymakers for a broader discussion about how to do health differently during the pandemic and beyond. The two sessions this month are going to be about how to create a health system that is an engine for economic growth. And I think what's so important is to help our politicians understand that without health, there can be no economy. And these two things cannot be mutually exclusive. At the final session in June, we're going to be exploring how to rebuild the health workforce. So you can find out more and register at cmahealthsummit.ca. Again, we really believe, and I certainly personally really believe, that physician engagement is so important as we work towards solutions in these and other areas. So I really hope to see all of you there. I believe you have the knowledge, the experience, and the expertise to guide the decision making and the work that we do. So before I finish, I was going to reflect a little bit on what I've learned through this experience of being CMA president. But first, I want to really reflect on the immense gratitude I feel for having had this opportunity. I have really, truly felt so proud to be a physician over the past 2 years. Again and again, I've seen our profession rise to meet this challenge in many ways, and in many ways, I think a lot of us would never have anticipated. And I think we've all found ourselves having to do things we really never thought we would be doing and facing challenges we didn't anticipate. And I think all of us at times have felt afraid. But we've continued because this is our work and it's our passion. And we're deeply committed to service, and we're committed to each other. And I think so much of what I see over and over again amongst my colleagues is how they continue to show up for each other, because it's so deeply important to them to make sure that their colleagues are supported as we strive to care for our patients. If I was to summarize sort of what I think I've learned in my 20+ years as a physician, I'd say these things. Tell the truth as you see it, whether people like it or not. Don't be afraid to have the hard conversations. That for me was probably the hardest thing to learn. Never be silenced. Your voice matters, and your truth matters. Use the space you occupy for good and to help other people. Do it with kindness and curiosity, but not with fear. So I'd like to really thank each and every one of you for your service, for your vision, and for your leadership. I know it has not been an easy time, but here we are together. I think we're all going to be able to get that positive energy from each other over the next 2 days, learn new ideas, and I hope leave inspired to continue this work. I myself am really looking forward to the chance to get to know some of you beyond your Twitter handle and see how tall you are in real life. So thank you so much for having me, and I'm welcome any questions, but only easy ones.
Hello, Dr. Smart. Marty Hattis from Edmonton. You finally get to meet here in real life, and I am super tall, so that's
I love tall people. Thank you.
thanks. You talked about, I really appreciate your role in advocacy, and of course that's how I built my career. But you talked about disrupting positions of power or power structures, and sometimes that, often these can include conflict, but it also comes a great consequence, particularly for people from marginalized communities who are trying to disrupt those power structures. As a trans woman, women, people of color within these systems. So what's your message to the people who are in positions of power, both socially and in the organizations, who we need as allies to disrupt that structure?
Yeah, thank you. I think, you've touched on many things. I think one of the challenges that I've really noticed, and I'm sure many people feel the same, is when we're trying to change systems and organizations, often the structures of how those systems are governed and the rules that we, bylaws and all those sort of things that we have to go through to create that change are reflective of old systems of power and ways of doing things, and I think largely often have been designed to allow the power to remain in certain people's hands. So I think that work can be really challenging, because I think often to really create the opportunities in a meaningful way, not just lip service to opportunities, those whole structures of how we make decisions, how we share power, how these things happen, need to also change. And I think we need to really be stepping back and looking at some of these tools that we use and asking ourselves, whose tools are these? And are they the best tools for governance, for leadership, for organizations to structure themselves now and today? So, I certainly don't think it's easy. It's even back to that question about how do we talk about physician salaries. Whenever you're talking about money or power, it gets tough, right? But I think what matters is that we're here, we're talking about these things. I think having organizations, not only pay lip service to the idea of equity, diversity, and inclusion, but really start to work towards those structural changes to bring those changes about so that they can be embedded in the institution, and actually part of how that work happens is going to be really important. And that's certainly something we're working towards at the CMA. But as we saw last year at the AGM, it was derailed, right? So we have to come back and rethink about what that needs to look like. But I also think in those moments where those types of things are derailed, it is a reminder to all of us that we can't just be passive and silent, right? It's like what we're seeing right now in the United States with Roe versus Wade. We can't get complacent about these things. And sometimes that means we have to show up at boring AGMs and vote on things if we care about changing the structure. So I think, one of the things we're also talking about at the CMA is the importance of training for future physician leaders, training in things like governance that maybe some groups of people have been excluded from, so that they can have the actual skills and tools to be able to take those structures and change them. So I think there's lots of work to be done there, but I also think there's no question that our profession and our country will only be the better by being more diverse and actually representing that beautiful range of people that is Canada. So that work needs to happen, but I think we need to be honest with ourselves about how our structures can prevent it.
Thank you. Thank you very much for your wonderful talk, really insightful. We share a couple of things in common. The profession of pediatrics, wonderful, advocacy. And unlike you, at home, they don't say I talk a lot. They say I listen selectively. I wouldn't know why.
Selective listening is an important skill.
I'm bringing in a different perspective because I'm not from Canada. I'm from a small island called Aruba. You're welcome, by the way. And, you know, I think this whole pandemic thing and the challenges we faced the past 2 years affected us all differently. And it brought some different insights, at least moving from the Netherlands to a small island community and having to deal with healthcare issues just at the beginning of the pandemic. So my question is, when I saw the changing role of physician leaders, and so if my question does not resonate well with the Canadian context, just say it's an international perspective. So my question is, I saw that list of things we should be doing as physician leaders, and I wonder about the socioeconomic equity in our communities. Because most of the opioid issues and other issues, infectious or whatever we might have, is closely tied to the socioeconomic status of individuals and their access to education and all that. So what I missed in that list was what we could do as physician leaders to improve equity in the socioeconomic domain. I mean, we're involved in politics, we're involved in healthcare, but you know, what roles can we play in improving the financial power, for example?
Thank you for that question. I think physicians have a huge role to play there. You know, it's interesting, right? People sometimes, there's been a lot of, through the various pandemic dialogue, things about, you know, stay in your lane. And I think we've heard a lot of physicians come back with everything's our lane, right? Politics is our lane, medicine is politics. And I think when we talk about health, why are some people healthy? The answer to that question is always social determinants, equity, justice. We know that, and I think that's a space we should all be in and thinking about, and I think we see many physicians who are leaders in those movements, who are strong advocates for social justice and speaking out on these issues. And I think that's why it's so important for us to always be asking politicians, you know, and reminding them, why are some people healthy while other people aren't? Because health is sort of that final funnel people end up in because of things like I was talking about, childhood trauma, poverty, all those things, right? So we, I think, need to be talking about those things, challenging those systems, and making sure that our politicians are creating better social structures for people, because ultimately, that is going to be what determines who's healthy and who's not, all those issues. So I think it is a really important space, and I don't think we should shy away from those conversations. And again, I think what we're really fortunate about as physicians is we have the opportunity to meet all sorts of people from all different walks of life. I've often thought, but what a privilege that is, because so many people I get to know through this work are not people I would maybe get to know otherwise. And I think it's our job to bring their stories forward and to advocate for people that don't always have that ability to do so for themselves. So I think it's of critical importance.
Thank you.
Touched on it in your talk. So you've done a lot of media. I'm not just saying this because you're speaking. I think you're very good. You give great messages. There have been other physicians who I think have not been given a great message in the pandemic. Alarmists, some people I would call activists more than advocates. And while I agree with you that we need to be curious, we need to all share a space, give our different opinions, and then hope to deal with the uncertainty. It doesn't always work out that way in reality. And so, in working with the media myself locally, the media has a tough job. They need warm bodies that answer their calls quickly. Yeah. And as much as I want to believe that they would take responsibility on picking the same people that are quote unquote good or giving good messages, it's not that realistic. And at the same time, when we try to police ourselves doesn't always go that well. You've seen some of the attacks on Twitter when you try in the most professional way to say to someone, are you sure that's really the message you want to give? And even some of us that have reached out to people privately, they don't take our feedback the way we teach our residents to take feedback. They get very defensive, and they don't want to hear from you. So I guess my question is, do we just hope that a bigger audience is listening to people like you, and that's going to sort of convince the majority of which direction we should go in, let's say, whether it's COVID or something else? Or is there an actual way that we can either be more responsible as a profession to make these spaces more safe? Because I would say right now, Twitter is really not the safest space to give your opinion on things.
I so agree. I feel like it's been therapy just listening to your question. This, I think, is a huge issue, and it's something I honestly think about a lot, because I can tell you, before I was in this role, I really wasn't in these spaces like Twitter and other things really at all. Like, I looked at it occasionally, but mostly it just made me angry, so I didn't. But then I felt like, okay, like I said in my talk, I feel like I have to be in those spaces, but I absolutely agree, and I think it relates to what Dr. Philpott was saying about the difference between sort of advocacy and just yelling at people. And I think we unfortunately have seen that polarization in the profession as well, and there are some very outspoken people who are very negative, very inflammatory, and have really kind of embraced that. And what I think is a bit unfortunate about spaces like Twitter, and that was also, I wanted to show that slide about what words garner attention, is the more extreme you are, the more inflammatory you are, the more attention you get, the more followers you get, the more your voice is amplified. So it's a real risk, I think, in those spaces that often that bad behavior is sort of reinforced by the followers who like that, right? Because people, I think, often are motivated by emotion. I think it is a real question for our profession in terms of what do we do or can we do about it? Because I think sometimes it is problematic, and it creates dialogue and discussion that's not actually helpful. And I think often people who are more balanced, as you said, are afraid to get into those spaces because of the pile-ons and the attack and the sort of things that can happen when you try to sort of challenge some of these things. So you end up feeling like you're kind of walking a bit on eggshells in terms of what that can look like. And it's also, I think, really hard to have complex, nuanced conversations on Twitter, right? But so, it's like people shouting at each other rather than saying, well, actually, what about this, what about that? And, it comes back to the question about some of the chief medical officers of health who have just really been disparaged in those spaces, I think, without any acknowledgement that this is a hard job. So I think it's a bit of a reckoning, I think. Like, these spaces aren't going away. We need to think about how we use them. I know myself, I've reflected a lot on what is the voice that I want to project in those spaces, because I feel personally a responsibility to try to present a balanced and honest and authentic voice in those spaces, recognizing there's a lot of complexity with what's going on. There's not always a right or wrong answer, but not fueling, anxiety or, just like those really negative interactions that I don't think look good for us professionally and aren't helpful to the public either. And I think that this is, to me, I think an area that we have to learn a lot about. I think it's new. I think we've been in that space way more during the pandemic, sometimes in a positive way, but other times absolutely in a negative way. And I think this is going to be an area that we all have to really think more about. And I think probably, like many things, train people in better, right? Like, so, even today, leadership, how many of us learned about leadership in medical school? We learned a lot about communication with patients, but how many of us learned about how to handle conflict with colleagues when we were medical students, right? There's many aspects to our work that really resonates when you're in this position that you weren't trained in. And I think social media and media is going to be one of those things where we have to start talking more about this with people and having these conversations about, what are the pros and cons and risks of these different approaches, and how can we make sure that we use our voices responsibly, because we do have a lot of power, and we need to reflect on that, I think, sometimes when we're using it and speaking.
Hi, so my question is pretty similar to my colleague over there. So actually it's about misinformation on social media. So I was quite intrigued by your slide, and I was wondering if CMA is actually looking at this as a priority, because we know that burnout has been on a hot list for CMA for a while now. I've read that survey findings that you talked about. So it makes sense, like on the burnout side, but how can we like pair it up with the misinformation aspect as well? So what I have noticed is like some of our physicians actually have been proponents of misinformation, like they've fallen prey to this as well. That has been a huge problem, because then people think that, because I think Dr. Fulport touched on that as well, the varying different opinions. So that's kind in between experts, but the differing opinions doesn't mean you should go into the realm of misinformation. So how like we as physicians have like handle rein, first of all, to physicians who believe in misinformation. Second, how are we letting public talk about medicine? So it's kind of quite interesting. You don't see it in any other industry. Like public doesn't have a say how the pilot flies the plane, right?
Yeah.
So how can they tell how a physician is practicing medicine? It's just so interesting how this has reached where it has, and how can we reverse it? And how can CMA help the physician leaders across the country to fight this? Thank you.
Yeah, thanks for the question. No, I agree. I often think about that too. You know, we don't crowdsource how to build a bridge or a skyscraper. We kind of assume people have expertise in that, and we ask them how. I think it is really challenging, right? I think we're starting now to see some of the regulatory bodies. So, of course, the CMA is not involved in regulating physicians, but we have now started to see some physicians be suspended and lose their license for some of the ones that have been really publicly propagating misinformation. I think, you know, the timeline for that was quite long. Like a lot of these things were going on for months and months before anything happened. So that, again, may be something where we need to be, as a profession, reflecting on, you know, how can we make sure that we're addressing these things more aggressively when they happen? Because I agree, I think these people cause a lot of harm. And again, what we're seeing, those physicians that have been those proponents of misinformation have generated these huge followings because people gravitate to that, right? So I think we need to really be clear that this is like a huge risk to people. It's as risky, in my view, as an incompetent physician who's continuing to treat patients. So I think, but again, I think our regulatory bodies are probably kind of catching up with this, right? Because it's sort of a new challenge. So we need to be thinking about that. The CMA is absolutely thinking about that health information space and what things we might be able to do as an organization to both support physicians to be in that space and communicating, and to be generating better information for the public. And I think it's going to be probably like a huge growth industry for doctors over the next months and years, because it's not going anywhere. And if anything, these spaces are only going to become more deregulated, right? When with Elon Musk, you know, buying Twitter, his main reason is he thinks that there should be, it's not free speech enough. So I think we're going to have these challenges, and I think we need to be able to position ourselves as relevant, authoritative, trustworthy sources. But I think we also need to learn how to leverage some of these spaces so what we're putting out there is catchy and interesting, you know, as opposed to just us standing, you know, at podiums maybe like this. I should be dancing a TikTok video to all of you right now. But I think we have to think about that, right? Because that's what we're competing against. And I think it's like any space that's been disrupted. If you're naive about it, you just get replaced. So I think that this is something that we need to be thinking, reflecting on, and really thinking about what are the skills and that we're all going to need to be able to counter some of these issues, because they're a huge problem. And I think we're starting to see, you know, we're losing ground of things that we've gained. You know, just even when you look at childhood vaccination, 1 in 4 Canadian children has fallen behind on their routine vaccinations during the pandemic. And, you know, and some of that is structural issues with access, but I also worry that all the controversy around the COVID vaccine has created more hesitancy for parents. So I think we're going to see some real consequences of misinformation, and it needs to be a priority.
Catherine, Andre Bernard, Doctors of Nova Scotia, good to see you up there. I want to start by saying how grateful I am, and I think we are, to see this legacy of leadership in the office of the President of the CMA in the last few years. And many of you, I see Sandy beside me here, Gigi was here before. We are proud of you as our collective voice, and you should know that, because it's hard to be in the limelight and to be at the face of the media. So you have our support, and I'd ask for a round of applause for Catherine.
Thank you.
What I wanted to ask you connects to this sort of silo, the echo chamber of Twitter, the silos that we all find ourselves in, and the yearning that physician leaders, and it connects to the moral distress that people are all experiencing. It's universal. How do we create connection meaningfully that unifies us as doctors in Canada. We're very good at saying, let's create affinity groups for people that have common interests, but that just creates more silos. What do you, from your own perspective, seeing and talking to members, being the president of the CMA the past year, how do you see personally the role of the CMA as being instrumental in unifying the profession of doctors in Canada?
Thank you for that very easy question. I knew I should have talked longer.
We sort of talked about this.
Yeah. No, this is, again, a big challenge. I would say, just in terms of feeling connected, to me, we've talked a lot about sort of the threats of social media and the challenges. There's also lots of positives, right? Like many of you, I've gotten to know you and your voice this year because of Twitter. I've connected with many colleagues and over Twitter and got to learn a lot from colleagues on Twitter, from things that they say or their work that they bring forward or the way they challenge things. And sometimes you say, oh yeah, I never thought of it like that. Or hey, there's a person I now know, and you kind of either connect there, or maybe you DM, or maybe then you get invited to speak or be at something because of those connections. So I think that what's nice about social media in that regard is that any of us can be connecting with each other on there asynchronously. It's easy, it's fast, we all have it on our phone, so that's an opportunity, I think, to feel connected with each other in ways that before might have been a bit more challenging. So I do like that about it. I think, in terms of the CMA's role in making everyone feel connected, I think that has to be the work moving forward, right? The CMA, as we all know, is in a very different role than the PTMAs because we're not negotiating for things for doctors. We're not actually directly influencing their work environment in terms of some of those practical things that the PTMAs have influence in. But that's also a strength because we're not tied to having to negotiate with the governments and that relationship, which I think can sometimes be a challenge for PTMAs because they have to walk that line with government as well. And because we're sort of at that national level, we don't necessarily need to be restrained by those things. So I think we're trying to advance issues that we think are of national importance, things like physician licensure as an example. And of course, trying to influence the federal government in terms of the direction they're taking with healthcare. But I also think we can perhaps lead some of these more challenging conversations around things that are harder at that PTMA level because of the direct tie that they have to how physicians are paid and their work environments. So I think it's going to be, I think right now we're at the stage where we're really reflecting on what that physician engagement model is. And I've been chairing a group that's looking at that, and we're redesigning how we're going to be engaging with physicians. So I'm hopeful that that's going to improve over time, and we're going to be creating more opportunities for people to get together and connect. Again, one of the positives, I think, of the pandemic is that we're all much more comfortable in virtual settings, which does, again, create more opportunities, right? You and I could be on a Zoom call together. We don't have to be in the same place. So I think we're leveraging more of these different tools. We're seeing it as an opportunity both to engage and connect people. But I think there's a lot of work ahead of us for physicians to really feel that emotional connection to the organization, feel like it's doing things that matters to them, and feeling like they can connect with like-minded colleagues across the country. But I think that is the goal. And I do feel that the organization is committed in working towards that. But are we there right now? I don't think so. But I think it's part of the work, and it's going to be critical to the importance and the relevance of the CMA as an organization.
Thanks. I'm just going to build a little bit on that last question. I believe, that we actually have competent physician leaders, at the PTMAs,
Yeah.
In our health systems, the regulatory bodies, in the educational institutions. We've got papers, documents, policy papers. We have the Naylor, report from a few years ago. The College of Family Practice 20 years ago described a blended model for payment for physicians that they were espousing and championing. But we don't have a forum, if we're talking about this. You mentioned the PTMAs, they can't actually bring forward healthcare transformation into the provincial level. The provincial governments, I argue, have a horizon of 2 or 3 years between elections, and healthcare transformation is going to take longer than that. And so there hasn't been an appetite for that. Does the CMA have a role, in creating a forum for that? Not about developing physician leaders, because I think that's part of it, but we actually have physician leaders, we have the thinking that's already there, but we don't have a way of having it have an impact, on the change that's necessary. So does can the CMA do anything there?
Yeah, no, thanks for that question, and I think it's so true, and I think that's part of the frustration is, as you said, we have a lot of knowledge, we have a lot of ideas, a lot of them aren't new ideas, a lot of the things that we know need to change, we've been talking about for a long time, and there's lots of different physicians that are invested and have expertise across these things. And I do agree, I think one of our challenges just in general in this country is the inertia of actually getting anything to actually happen with what we know. And I think that what you've described is the direction the CMA is trying to head, right? I think there's been a big restructuring at the organization, there's a new strategic vision about how we're heading forward. I think that vision is rooted in trying to create transformation in the system, and I think there's a recognition that physician voices need to be part of that. So I think I would say stay tuned. I think there's going to be more opportunities coming, but I do think that is a critical role for the CMA to play, and I think we all recognize that, and this is, is something we've been saying, no one health system, meaning a province or a territory on its own, is going to be able to independently achieve this change. We need some federal leadership, and we need to identify some of the issues that are pan-Canadian that need to be implemented everywhere. So that's going to be important, and we're trying to bring that voice forward. And I also agree with you, one of I think the biggest challenges we have is in our political structures where, the focus is on being reelected. Those timelines aren't long enough for the people that start that transformation to get credit for it. So how do we really get our politicians to realize, this is no longer optional? The system is going to fall apart if we don't actually get serious about this. So I do think we're at a moment in time where it's never been more on people's minds, perhaps, than it has been, including your average Canadian, because healthcare has been so in the media over the course of the pandemic. So I think it is top of mind. I think what's going to be critical is what you're saying is how do we take this collective expertise and leverage it to action? And that's the tough question, right? Like, we all know what the issues are. I think we have lots of ideas about what needs to happen, but how can we create the spaces for to actually move to the action part? And I think that's the hardest with any change. But we're working on it, and I hope that we are able to create opportunities where people feel like they can have that input, and we then can start to see some of the changes that we all know are so needed.